Patrick Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies. We also provide tailor-made solutions for hospitals and intensive care units whilst providing quality care for long-term ventilated adults and children with tracheostomies. Medically complex patients at home, including home TPN, home IV potassium infusions, home intravenous infusions, home BiPAP, home CPAP, home tracheostomy care for adults and children that are not ventilated. We also provide IV antibiotics at home. We provide port management, central line management, PICC line management, as well as Hickman's line management. We also provide palliative care services at home. In essence, we are providing a genuine alternative to a long-term stay in intensive care. So today, I want to answer a question from Sonia, who contacted me, and I spoke to Sonia on the phone, and Sonia said, hey, my dad's in hospital. He is in palliative care after cancer. They want to send him home with palliative care services, but he can no longer eat and drink, and we want to give him IV fluids. Is this something that intensive care at home can do? Absolutely, we can. That is part of our palliative care service. If someone wants to be discharged from hospital, the hospital can no longer offer treatment, but palliative care can be offered at home, of course, and it's a much better environment at home. Of course, we have done many palliative care situations at home, once again focusing on quality of end of life at home rather than in a hospital. What do we need for it? We do need a script from a medical practitioner for IV fluids. We do need an IV cannula, ideally a PICC line. Sometimes in those situations, we have also commenced TPN, total parenteral nutrition. It's basically intravenous nutrition for patients that can no longer eat and drink. Always under the guidance, of course, of a doctor who can prescribe TPN or IV fluids. Sometimes that can come from even after hours GP. There's also a great organization now, My Emergency Doctor. I can only recommend them. They're pretty good in managing situations at home, including palliative care. So that is really my tip for today for anyone that is in a situation like that and is looking for alternatives at home. This is certainly something that is right up our alley, which in this case includes palliative care. So if you need help at home, if you're in a hospital and you want to go home, if you're in intensive care and you want to go home, if you're a family having a loved one in intensive care long-term or in a palliative care situation, please reach out to us. You will find us at intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. With intensivecareathome.com, we are currently operating all around Australia in all major capital cities and regional and rural areas. We are an NDIS-approved service provider, TAC in Victoria, NII-SQ in Queensland, ICARE in New South Wales, DVA all around Australia. We are also having received funding through public hospitals, departments of health, as well as private health funds. We are also providing level 2 and level 3 NDIS specialist support coordination. We are also providing nursing assessments for NDIS funding. And like I said, if you have a family member in a similar situation, we would love to hear from you as well. If you are at home already and you have insufficient support, maybe you have support workers instead of intensive care nurses. There's a big difference there. And it's also really dangerous if you have support workers and it's not evidence-based most of the time. We would love to hear from you and help you to take your funding to the next level in your journey and have intensive care at home, especially when it comes to long-term ventilation, tracheostomy, BiPAP, CPAP, and so forth. And again, if you need level 2 or level 3 NDIS support coordination, and if you don't know how to get onto the NDIS, please reach out to us as well. Or if you feel like your current NDIS support coordinator is not doing their job by not getting you nursing care, we would want to hear from you as well, because we can help you with the advocacy. We have done it many, many times successfully. Also, there has been a court case recently where the NDIS was trying to challenge not to pay for nursing care for their participants, and it has been knocked back not only by the NDIS tribunal, it has also been knocked back by the federal court. So don't let anyone tell you that the NDIS isn't funding nursing care. It's all evidence-based. And if you are a critical care nurse and you're looking for a career change, we want to hear from you as well. If you have worked for a minimum of 2 years in critical care ICU, ED, or pediatric ICU, or neonatal ICU, and you ideally have completed a postgraduate critical care qualification, we want to hear from you. We are currently having jobs in Sydney, Melbourne, Brisbane, in Albury, Wodonga, on the New South Wales-Victorian border, also in Bendigo, as well as in Warragul, in country Victoria. We absolutely want to hear from you. Please also note that if you are interested in working for us, we are not an agency. We are a service provider that has a tailor-made solution for our clients, and that means we're really looking for competent staff and confident staff that want to work with our clients and want to build relationships with our clients. This includes working regular shifts with them. Don't come to us if you're wanting agency work and come and go. That ain't going to work for us and for our clients. Certainly our clients don't want people coming and going. We're looking for building stable teams for our clients on a regular basis. Therefore, we want people to have a real commitment to our clients and to us as an organization to do the work that we are set out to do. And if you are an intensive care specialist, we are currently expanding our medical team as well. If you are an intensive care specialist and you have bed blocks in your ICU, which I know you have, then I encourage you to reach out to us as well. We can help you eliminate your bed blocks in ICU and ED by taking your patients home, which also includes palliative care for some patients at home. Talking about ED and emergency department, we are also sending our critical care nurses into the home of people and into residential aged care to keep them out of ED. So we're also providing an ED bypass service if you are interested in that. And if you're a hospital executive watching this, we also want to hear from you, because once again, we can help you eliminate your bed blocks in ICU, ED, respiratory wards. And if you're an NDI support coordinator and you're looking for nursing care for your participants, or if you're looking for other NDI specialists, support coordinators, or NDI's nursing assessments, we want to hear from you as well. Once again, please contact us on one of the numbers on the top of our website at intensivecareathome.com, or send us an email to info@intensivecareathome.com. If you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have, and share the video with your friends and families. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.